Good morning. I'm Gordon Smith, the state's director of opioid response in Governor Mills' office. It's my pleasure to welcome you to our first monthly webinar that's resuming since the Governor's Summit back on July 10th. It's a pleasure to welcome you on Recovery Month. I think that one of our presenters today will be making some comments about the significance of Recovery Month. I want to remind you that the recordings of the plenary sessions and one of the rooms from the breakout sessions from the summit are all recorded and available free of charge on the ADEP, used to be AdCare website, and call that to your attention. All of our monthly webinars are also recorded and available to you for viewing. In conjunction with that, let me announce the topics for the remaining monthly sessions for the next 5 months, and then by the end of the year, we'll announce the topics for our monthly webinars preceding the July 16th, 8th summit and final summit for Governor Mills, which will be up in Bangor at the Cross Insurance Center, and next July 16th. So again, the webinars are always the first Friday of the month. Sometimes we'll vary if there's a holiday at 11:30 a.m. and they last for 1 hour. In October, I'm very pleased to say we're going to present a program on our youth recovery coaching. That pilot in the down east is really going well. It's helping a lot of people, and we'd love to expand it. And I know there's going to be a course, another opportunity to be trained as a youth recovery coach coming up here very shortly. So that will be October 3rd. In November, we're presenting the information from the annual report of the prescription monitoring program. We've had the prescription monitoring program now for roughly 21 years. And Dr. Elizabeth Fowley-Mock who's a consultant physician to the Office of Behavioral Health, will be presenting that information along with others. In December, we're going to have a program on the CCBHC, the Certified Community Behavioral Health Centers, and in incorporating how to incorporate substance use treatment expansions into that model. It's going to be presented by Community Health and Counseling Services in Bangor. And then in January, we're going to bring back Roland Robinson, our former colleague who has the 2-year fellowship with the Andrew Weil Foundation to study drug policy in Europe and Brazil. Roland's in Brazil. He says it's quite complicated down there, things. And he wanted from now to January to get his thoughts together on what we might learn from how they deal with drug policy in the country of Brazil. So that's what we've got going today. I'll introduce a minute our presenters, but I would ask that you put any questions today in the question and chat, question and answer, rather than in the chat. In my little machine here, I have to go over to the additional more, click on that, and that's where the question and answer thing is. Today, we're going to talk about legislative action that was taken during the first regular session of the 132nd Legislature. Really pleased to have 2 presenters with me. I'll be moderating and then covering quickly 4 or 5 bills at the very end of the session, and we'll try to save some time for questions. But we'll also be answering questions sometimes as they are presented in the question and answer box. So I'm joined today by 2 terrific guests. Courtney Gary Allen, the executive director of MERAP, and I'll say more about Courtney in a moment, the main recovery advocacy project known to many of you. And we had over 300 people registered today. So the vast majority of you are quite familiar with Courtney and her work. And we're really pleased to be joined by Representative Ambureen Rana from Bangor. Representative Rana is serving her second term in the legislature, serves on the prestigious Joint Standing Committee on Appropriations and Financial Affairs. She represents District 21 in Bangor. I think it'll be of interest to many of you to know that before coming to the legislature, Representative Rana was a community organizer and also worked for a period of time for one of our syringe service providers in Bangor. She also has presented really significant legislation in the SUD area, both last session and this session, which is obviously why we invited her today to join us. And she'll be covering a couple of those laws between Courtney's presentation and my presentation. I want to say a few more things about Courtney. She is, a mom, a spouse, a law student, has lived experience, spends lots of time at the State House, and does terrific work there. She's also a former member of the Maine Recovery Council, and I had the pleasure of serving. She and I both had the pleasure of serving for the first 2 years on that council, and we're quite proud of some of the projects that we championed and now are opening. She's also a current member of the Augusta City Council, and recently opened a recovery center called the Access Center on Water Street in Augusta, and I was able to attend the opening of that. It was just it was a couple hundred people and a very impressive opening. So with that, as usual, when Courtney and I do things together, she has put together a terrific PowerPoint that's not only filled with good content, but actually looks very pretty. And I'm going to turn this over to Courtney. And again, then we'll go right to Representative Rana when her slides come up. I will be back with you probably in a half hour or so and finish up on my bills. Thank you, Courtney.
Thank you so much, Gordon. I appreciate your nod to our presentation. I will also just give a nod to Tess Parks, who is our policy director, who designs all of our background stuff. So thank you, Tess, for your work on prepping me with this PowerPoint. So hi, everybody. My name is Courtney Gary Allen. Gordon did a wonderful job of introducing me. But first and foremost, and most importantly, especially on the first week of International Recovery Month, I am a person in long-term recovery. And for me, that means in just a couple of months, I will celebrate a decade in long-term recovery. Recovery has given me everything that Gordon mentioned in my bio, but most importantly, recovery gave me my children back. So I'm celebrating with all of the people across Maine, the nation, and the world as we celebrate Recovery Month. And I think it's also an important nod to the voices of people with lived or living experience across Maine that on the first week of Recovery Month, we are celebrating the good policy work that has happened here in Maine to help reduce overdose deaths and support recovery. Every piece of legislation I dedicate to the advocates who fought with us and the lawmakers who stood with us, and to Governor Mills. So thank you all so much. Very quickly, MRAP, which is what we call our network across Maine, is two distinct organizations, the Maine Recovery Access Project and the Maine Recovery Action Project. They are sister organizations, deeply intertwined with each other. We collectively call them MRAP, and I have the honor of being the executive director. The difference between them is the Action Project focuses on community organizing and political action, while the Access Project focuses on delivering community-based services, education, and resources all across Maine for all of our versions of people who have been impacted by substance use. Together, we work to address both the systemic and the holistic community-based response to substance use. We thank our fiscal sponsors and national parents, Mobilize Recovery and the Recovery Advocacy Project, who helped found us in 2020 and helped us transition into our own nonprofits now. Very quickly, and then I'll jump into all the legislation and all the good work of our great Maine state legislature. Our theory of change is truly that we are a listening's first organization. Everything that we do comes from the grassroots up. All of our work is dedicated and grounded in the lived experience of people who use drugs and who are in recovery or who have been impacted one way or another. And so what that means is we hold listening sessions all across Maine. We hear directly from people about what they want to see changed in the policy landscape. From there, we organize our community and we take political action. We believe that change happens at the policy level, is implemented on the ground level. And because of that, through our work, we have also helped to expand resources all across Maine, from the Access Center to our volunteer program to knocking on 10,000 doors, supporting young people, and one of my personal favorites, hosting community cleanups, particularly in downtown Augusta, but also getting to support our partners in Lewiston and Bangor as you expand your work to do the same. And with that, I will jump into some pieces of legislation that were passed this year. We will primarily focus on this year, though we've woven in a few pieces of legislation from previous years that are very important to our movement. First, this year, the Health and Human Services Committee passed LD 110, which is a bill that seeks to increase transparency of Maine's opiate settlement money all across Maine. What the bill requires is that municipalities, or what we call subdivisions of opiate settlement that are receiving opiate settlement money, is going to have to report out how they're spending that money. And so if you don't understand or don't know, or this is the first time you've ever heard about opiate settlement money, welcome. There is millions of dollars all across Maine right now. It's located at different parts of government. So the Maine Recovery Council, probably you have heard of that. The Maine Recovery Council is responsible to oversee 50% of that money. That body is made up of 15 members who are appointed by other representatives, and they represent from substance use professionals to people with lived experiences in the subdivisions. So they have 50% of the money. One of the things that we don't talk about a lot, or people aren't quite as aware of, is that there's also this other 50% of the money. So the Maine Attorney General also has the honor of stewarding 20% of those funds, and that is situated within his office, Attorney General Fry. And then finally, this direct share to the subdivisions. And when I say subdivisions, what that means is that there are counties and municipalities all across Maine who have received pots of money, totaling 30% of the opiate settlement money, but split up between 39 Maine cities, towns, and counties. And what this bill does is it requires that those subdivisions, counties, towns, and municipalities report out how they're spending this money. We are very excited to see that report. We expect the report to come out in January of 2026, and the Attorney General to report back to the Health and Human Services Committee. We thank Representative Brennan for his work on this piece of legislation. And I won't cover all of this. You will get my slides in case you're interested. This is a breakdown from the Attorney General's website about how much money each of these entities have received up until August 11th of 2025, so just last month. Again, we don't know what they've spent because that bleeds back to LD 110. There's been a lot of reporting around it, a lot of efforts to try to figure out what's been spent, but LD 110 will give us the concrete answers that we've all been looking for. So this is really about how much have they received. And we are actually today releasing our toolkit on this. So if you're interested in learning more about if you live in one of these towns, you can go to our new website page. It's www.me-rap.org/opiate settlement. Just read the screen. Don't listen to me. And on that website, you'll see all kinds of information and tools for you to get involved and learn how to learn more about what is happening in your community around opiate settlement money. We encourage you to do that. This is our money. This is the money that was received from prescribers of Oxycontin and other opiates, and such as Purdue Pharma and others. Um, I am a person who grew up in a family directly impacted by the actions of Purdue Pharma. And therefore, I believe that this money needs to hit the ground. And yeah, so we're getting involved in that, and we encourage you to do the same. Again, if you're interested, this slide deck will go out. There is an opportunity to get involved. Moving on. Okay, so all of you, many of you probably already know that Maine has the strongest Good Samaritan law in the nation. That is still true and will remain true if I'm involved. So before I dive into any of this legislation around the Good Samaritan law, if the one thing you take away is please remember that Maine still has the strongest Good Samaritan law in the nation. What I will say, as not an attorney yet, but will be an attorney someday, to make a defense attorney very happy, I am now encouraging people when you call 911 to say, I suspect an overdose. And the reason for that is there is a Maine Supreme Court decision that is complicated. But what I'll say is that the court says that you, as the caller, need to suspect an overdose, right? So they don't say that you have to say those things to be protected, but I'm training people now to say those things as the most protective way to ensure that the Good Samaritan law protects you. So say I suspect an overdose, and if you don't, there's still protections, but try to say overdose. Okay, now moving on to the piece of the legislation that were debated this legislative session. So there was LD 1024, an act to expand the list of crimes that do not qualify under Maine's Good Samaritan law. It sought to do exactly what the title says, expand the list of crimes not covered when you call 911. There was intensive debate in the Criminal Justice and Public Safety Committee, and the Criminal Justice and Public Safety Committee voted majority ought not to pass, and the House and the Senate handily defeated that piece of legislation. It is now dead on the files. Moving forward, there is also a currently pending piece of legislation, LD 1646, sponsored by Senator Rachel Talbot Ross. This bill was held over. If you don't know what that means, is that the legislature has the opportunity in the first session to say, we don't have enough time to debate this right now. We're going to talk about it in January. So that's what's happening with this piece of legislation right now. The way it's currently drafted is that it seeks to clarify what triggers the Good Samaritan law. And so this actually responds to that, what I previously spoke about, the Maine Supreme Court decision, in an attempt to define what we mean when we say overdose in the piece of legislation. It's a very, what I would like to call, commas and periods bill. It makes sure that it is as tight as possible, and that the original intent that many of us all worked really hard for is being upheld in the decisions that courts make if somebody does end up in court over a charge at the scene of an overdose. Long story short, Maine has the strongest Good Samaritan law in the nation, and we will continue to protect that law at all costs. And also we'll work on ensuring that the commas and periods are correct. All right, two more bills that were held over this legislative session. These really focus on the idea that in recovery, things happen while we're in active substance use. And once we move into a recovery process, whatever that looks like for the person, that we believe in second chances in the state of Maine. And so these two pieces of legislation seek to create second chances for both people who have been impacted by the criminal legal system and people who have been involved in the child protective system. I'll take the first one first. LD 1911, sponsored by Senator Rachel Talbot Ross, seeks to create an automatic process for sealing criminal records for eligible crimes. It's a very long list of eligible crimes and amount of times that somebody would have to be away from that criminal offense to be sealed. Happy to chat about that offline. But pretty much what the bill does is it creates literally an automatic sealings record. In my case, right, it's been 10 years since I was charged with petty theft in active addiction. This process would create a process that the court would be responsible for sealing that record and saying, you have been far enough away from that criminal offense to deserve a second chance, and for it to not come up when you are when you're looking for a job or etc. Yeah, so that one was held over, which means that the debate will begin in January of 2026. Next up, LD 1922, which is honestly sort of like LD 1911, except it focuses on child protective records when you have had an active involvement with the child protective system. And it seeks to seal those child protective records if you've been away from that child protective history for a period of time. Again, this is a piece of legislation that's really focused on workforce development, ensuring that parents and people who have been incarcerated have an opportunity to have really good jobs and to not be held back by things that they have changed or things that they've worked on. This bill is actually kind of in a limbo process. There is another bill, LD 1710, Gordon will talk about it, that has created a little bit of a working group trying to figure out, again, the commas and periods about how we would do this while also protecting Maine's children and families across Maine. I'll let Gordon speak to the rest of it. I think this is my last slide, and then I will pass it over to Representative Rana. Also, there was two pieces of legislation regarding housing in the state of Maine at the crux of recovery housing. The first one is LD 1946, an act to clarify the eligibility of certified recovery residences for Bridging the Gap. No, that's an organization in my town. Bridging Rental Assistance Program, also known as BRAP. A lot of people call it BRAP. Very simply, what this piece of legislation does is that now in the state of Maine, if you are living in a recovery house and you are otherwise eligible for a BRAP voucher, which has a very long list of eligibility, you are able to apply for that BRAP voucher. It cannot be used in a recovery residence. It is a pathway to long-term housing, so an apartment or something like that. There's a little bit of a caveat on this piece of legislation. There's no money in the BRAP voucher system right now, so that's a whole other thing that we need to talk about someday. But when there is money in the BRAP voucher system, people who are living in a recovery residence who are otherwise eligible for a BRAP voucher would be able to apply for those vouchers to be used in a more stable, more long-term housing situation. Okay, that was a lot. Last but not least on my list is LD 215. This speaks to a previous piece of legislation as well. This bill, an act to establish a program to assist residents of a large recovery residents. This is Representative Hassenfuss's bill, who represents the town of Winthrop, which is important to the context. This bill creates a system for the general assistance eligibility of people who are in recovery residences. So a couple of sessions ago, we worked to ensure that people who live in recovery residence are eligible for general assistance at the city level. That is because this is housing, people should have access to housing and general assistance, etc. That created a little bit of an issue, which this bill seeks to help with. So what it does is that if a large recovery residence, and this is defined as 26 beds or more, is situated within a municipality, the person who lives in that recovery residence remains eligible for general assistance. And I hope that you take that home with you. That's the important part. People who live there are eligible for general assistance. Under that is a whole structure of funding, how you fund that person's bed. And so what this bill does is it transfers the responsibility from the municipality to the state. That's a long way to say it. Pretty much the state is going to pay 100% of that person's cost to live in that bed instead of splitting it with the municipality. Also, DHHS is working to convene a stakeholders group to review how we fund recovery residences all across the state moving forward. And we look forward to their findings. And with that, I pass it to my good friend, Representative Rana.
Thank you so much, Courtney, and thank you, Gordon. Hi, everyone. My name is Ambureen Rana, and I'm excited to tell you about a couple of the bills that we've worked on over the past couple of years. Starting with LD 1714, a bill we're super proud of. And if you haven't heard about it, it was an act to create sustainable funding for recovery community centers. And I'm sure all of you are familiar with recovery community centers. They're organizations that are led by people from the recovery community, and they provide services, recovery-focused outreach programs, recovery coaching, harm reduction activities, skill building groups, and a broad range of programs for people in any stage of recovery. So this was a huge effort of grassroots organizing, similar to what Courtney was describing earlier in the presentation about how this work that we're doing comes from the ground up and is informed by people that are directly affected. And so this bill was signed by Governor Mills, and beginning of earlier this summer, $2 million will be transferred into the Recovery Community Center Fund to fund Maine Recovery Community Centers. And the first round of funding was just awarded to 9 recovery community centers all across the state. So these are centers that are in rural Maine, in urban service centers. But I think it's really important to acknowledge that this funding is going all across the state. And the public hearing was incredibly moving, and I think that contributed to why this was a success. I sat on the taxation committee last session, and it's not very often that you hear moving stories in that committee, and I think that really contributed to the success. People with direct experience in recovery worked so hard to make this possible, to share their vulnerable, heartbreaking stories about how recovery community centers help them in their recovery process. And it really just makes sense to use cannabis funds in this way. And the cannabis industry agreed with that and we collaborated with them to make this possible. We can head to the next slide. Perfect. So I'll start with LD 219, an act to limit hypodermic apparatus exchange programs for a one-to-one exchange. And this bill we were able to defeat. It would have required all certified syringe programs to operate using a one-to-one model, which is extremely regressive. And if this bill were to pass, it would have been really harmful to communities across the state. It would have just been very restrictive for people that are trying to access this service. So we're really grateful that the legislature was able to recognize that and to keep things the way that they are. And the next 2 bills that I talk about expanding services. So you'll have a little bit more context on that. So LD 1078 is a bill that I sponsored, an act to support Maine's public health objectives by increasing access to evidence-based, that's the key word, evidence-based harm reduction services. And we were able to successfully pass this law through the Health and Human Services Committee. Harm reduction services are under attack in our state, and they have been. So it was really important for us to emphasize that the work that we're promoting is evidence-based and is proven to support affected communities. So this bill allows service programs that are certified by the Maine CDC to operate in additional locations, days, times within the same county where they're certified in order to meet communities' needs. And this is pertinent, especially in the housing crisis that we're in, with people living in encampments, and those encampments being constantly swept by municipalities. We need to be able to meet people where they're at and to to provide them services wherever they are, especially when they're moving from place to place. And it's hard to do that with a fixed location. So this bill really helps us meet people where they're at, especially as they're shifting. So it enhances public safety efforts by decreasing the number of improperly discarded needles in public spaces, and it increases the flexibility of these syringe service programs so that they can expand their public health efforts, which results in the reduction of disease transmission, which of course leads to costly medical conditions. So this bill is essentials, and we're really proud to have been able to pass it through the Health and Human Services Committee and for it to become law. And all of these bills that I'm covering today, I do want to note, I'm happy to talk more offline about them and to give you more information. And we can also be sure to send out, if you'd like them, fact sheets about this bill, so that if you want to talk about them in your communities, you'll be able to have the language to be able to do that. And so this last bill that I want to talk about is an LD 1738, which is also a bill that was in the Health and Human Services Committee this year. It's an act to establish a grant program for funding to support public health efforts in the state. So this would have been a grant program to support the funding of disposal containers, proper disposal of syringe waste, staffing. And so this bill passed through the Health and Human Services Committee. It passed through the House and the Senate, and it passed through appropriations, and we were able to get it funded. Unfortunately, because of budget restraints, we weren't able to get it. It's still sitting on the governor's desk, awaiting action. So the hope is to convince the governor that we can get funding for this bill. It basically opens up an account so that we can ask for grants, which is something that advocacy organizations can do. We're also hoping to, there are very creative ways that we can fund this bill. So we just need to be able to convince the governor that we can do that. And this bill addresses exactly the issue that communities are asking us to address, which is syringe waste. It's the biggest complaint that we hear across the state. It's the biggest argument that we hear against harm reduction services. And so it's a really big deal that we were able to pass this, because it was a reminder to those communities that the way to address syringe waste is by funding it. It's not by eliminating harm reduction programs. It's not by minimizing syringe service programs. It's not by bills like LD 219 that would have brought us back to a 1-to-1 exchange rate. It's by actually dedicating resources to clean up syringe waste. So again, this bill enhances public safety efforts by decreasing the number of improperly discarded needles. And if this is a bill that you care about, please do reach out to us, and we can talk about how we can make sure that it becomes public law like the other bills that we talked about.
Thank you, Representative Rana. And with that, I will pass it over to my good friend Gordon Smith.
Thank you, both Courtney and Representative Rana, for those presentations. I want to mention, I don't think we've said previously, that the effective date of the laws that were enacted during the last session is September 24th, later on this month. Now, some bills have a specific date specified in them, and some that were passed on an emergency basis went into effect already. But under normal circumstances, bills become effective 90 days after the adjournment of the session, which is this year, September 24th. Wanted to mention that. We're going to start with 779. That was a bill to fund an adult treatment court in Aroostook County. A lot of work went into that over the last 2 or 3 years. Aroostook County is the only county that presently today is in the judicial region, which does not have a specialty court. So our specialty courts would include the adult treatment courts. There are 7, I believe. Then we have some family courts that including one here in Kennebec County, and we have a couple of veterans courts. So every judicial region has an alternative pathway for people who are eligible, except for Aroostook County. And fortunately, now some money was put together through the Overdose Prevention and Treatment Fund, which is a fund that's populated with license fees and registration fees from pharmaceutical manufacturers each year, producing between $1 and $2 million a year. And that money is being used to at least fund for the first year a treatment court in Aroostook County. Because of budgetary constraints, that money is not available till next July 1st, 2026. And so the court is expected to begin sometime that fall or in the winter. It's about $740,000 a year to operate a full, fully staffed treatment court. They are expensive, but they also, the data shows in our evaluations of the court show that they're very effective. And I mean, I don't think Courtney would mind me telling you she's a graduate of one of our courts. Other people on this, I'm sure, that are Zooming with us today also are. So we're just pleased to be able to say that now we'll be able in every judicial region to have such a court. 1266 is a related bill. It simply requires the Office of Behavioral Health put together a working group to try to expand on the reach of our treatment courts. That is being put together through my colleague Rob Porter at the Office of Behavioral Health. Rob handles our criminologic contracts, and I know that the working group actually is having its first meeting this afternoon. And I think there's a meeting planned each month between now and the end of the year with a report due back to the legislature by January. So hard to know what's going to come of that effort, because there's no identifiable funds beyond what is already being dedicated to operate the courts that we have now. Next. The 503 was a bill that was prepared by the Substance Use Disorder Services Commission, chaired until recently by Bruce Campbell and now chaired by Leslie Clark. And it's a statewide statutory commission that advises the legislature, the executive branch, the public on SUD-related legislation and issues. And it made some technical changes at the request of the commission itself. They made some technical changes. They will, for instance, they were required to meet every month, and this requires them to meet every other month. They also plugged into their statutory authority harm reduction. Harm reduction wasn't previously an area that was mentioned in the legislation. And they tweak a little bit the membership of the group. They put in somebody, a representative of the tribes. They also reduced the educational people from 2 to 1, so these are mostly technical changes and that were enacted and take effect on the 24th. Commission continues to be an important source of information, and I have no doubt there's some people with us today that are members of the commission. Governor, appreciate your service. Next, I'll do 156. That's the bill that we alluded to earlier, that this really relates to how the state and the Office of Child and Family Services deals with reports of maternal drug use, when there's a potential of a substance-affected infant. There's been an effort over the past few years to try, under the terms of the federal law and the state law, to get the hospitals to be more uniform in their reporting. Best example of the variations, for instance, is that some hospitals report marijuana use, some do not. And so it makes suspect a lot of the data that you see that, oh, well, in a given year, there were 800 babies affected by, drug use by their mom. Well, it, until you look at the categories of drugs that are used, I mean, there's a difference between whether you're using nicotine, alcohol, marijuana, or fentanyl. And so this bill was passed to change some of the definitions, change the definition a little bit of family care plans, and also it has resulted in a very active working group put together by Bobby Johnson, the Director of Child Family Services, of hospital lawyers, assistant AGs. I meet with them, making very little contribution, but I'm following the issue quite closely. Elaine O'Connor, some of our clinical providers, that group is meeting 6 to 8 to 10 times to try to get agreement on changes to the rules, so that that would result in more guidance to the hospitals as to what the department is notified of, as opposed to what is reported as a potential child welfare issue. So it's a complicated issue. We've been working on it for 6 years, but the efforts continue, and LD 156 was a part of that. LD 710 was a bill sponsored or at the request of the department through the Office of Behavioral Health, and it made some changes to the naloxone community distribution law. That was a law that was passed through a compromise with the LePage administration way back in 2016 or so. And it was fairly stringent in some of its provisions as we were fighting about the availability of naloxone. It's almost unbelievable as we look back at that time and realize how far we've come. I think the last number that I saw was we're almost up to like 800,000 of doses of state-provided naloxone that we provided across the state. And but I remember when Sarah Gideon and I took and a woman at Maine General, Jane, I'm sorry, I won't remember her last name, but the terrific harm reduction person. And we took the first naloxone bill up to the Judiciary Committee around 2015 or so, and didn't get a single vote. Couldn't even get the state to approve even the availability of naloxone. So we've come a long way in 10 years, and 710 is a nice culmination of some of those efforts. What we did was clarify that training was not required in order to distribute naloxone. Obviously, now that it's available in some forms over the counter, the FDA and DEA have concluded that the package insert and the directions on the containers themselves are sufficient instruction. Now, it doesn't mean that we're not going to do training, but we don't. But we were sometimes the training in the original law was a barrier to, let's say, getting a nalox box up in the lobby of a city hall, and then the lawyers would call me for the city and say, "Well, how can we ensure that the person that accesses the Narcan, is properly trained under the statute?" So that I don't get those kinds of questions, we've simply removed the training requirement. We also made clear that vending machines was an available option for a naloxone distribution program to have. We do have two vending machines in the state, one in Lincoln County, one in with the Micmac tribe in Presque Isle. They are increasingly popular. They're available 24/7 to anyone. And you can understand, I think, the benefit in terms of reducing stigma or not facing stigma for somebody to just be able to go in 24/7, not have anybody asking them any questions, and access out of that machine, naloxone. So there's people that want to fund additional efforts at vending machines. They have many vending. We have 2. In Rhode Island, they probably have 100. So this bill expressly authorizes that. I want to acknowledge Representative Sam Zager, who sponsored the bill for the department. Dr. Zager is the only physician currently in the legislature, who represents a district in Portland, and sits on the Health and Human Services Committee. That is, I believe, Courtney, the last bill that we wanted to consider. We've got about 13 minutes left, and we do have some questions. So I'm going to tee up the ones that we didn't answer as we went through, and ask you and Representative Rana to help me with them. Some of them are a little complicated. So let's start with our friend, psychiatrist Dr. Maltz, who asks, how will federal actions against harm reduction services affect progress in Maine? While I think about that for a minute, would either of you like to make a comment on that? Apparently not.
I can answer as a community member, saying
Sure.
that, under other administrations, we made harm reduction services work in previous before we had these protections and these laws, we worked in communities to be able to protect our neighbors and our community members and to provide them with the services that we need. If you reflect on the 90s in the HIV epidemic of like the late 80s and the 90s, that's what we did. We're going to continue to do that. So I would say that as this is more of a values discussion, and then I'll let Courtney and Gordon get into the more policy part of it. But we took care of each other, then we're going to take care of each other moving forward.
Yeah, Representative Rana, I was actually going to start there as well. Harm reduction is a long-standing movement of people who use drugs who have fought with and for each other for more decades than I have been alive. And we have been caring for each other for all of that time. Harm reductionists and people who use drugs will continue to do that regardless of whether or not the policy is there or the funding is available. We are quick on our feet and we'll continue to do that. So that's my value-based harm reduction has been here and will continue to be here regardless of the policy decisions our policymakers make. And then I will move to the commas and periods. So I'll speak to the executive order that Trump released a couple of weeks or months ago now. I actually read that, and my reading of it, and maybe somebody can say I'm wrong here, is that not much actually changed. There was the things in that executive order are how we have been operating across the state for a long time. And so while I may not personally agree with the way that we spoke to that in that order, I don't think that the impacts are as dire as they could have been based on the language of the document.
Thank you, both Representative Rana and Courtney, for those thoughtful answers. I would say, David, that first of all, we don't use a lot of federal funds in our most, with respect to our harm reduction activities, particularly with respect to syringe service providers. Virtually that's all state money, and we don't use any federal funds. We do use some federal grants for naloxone distribution, but the federal government seems in that executive order to be much more concerned about the syringe programs than they are naloxone distribution. And those, of course, are really our two primary, in my opinion, harm reduction activities. I mean, no doubt the fact that our overdoses, even this year, are still down at the end of July, and the July report was posted this month, or was posted this week. We're down 27% from a year ago. A lot of this is naloxone. It's not the only thing by any stretch of the imagination. So I think that the federal government's making a lot of noise about harm reduction and not supporting it will have limited effect on what we're doing here in Maine. And I think that's kind of the summary from all three of us.
Yeah, I will just say the document explicitly allows for naloxone.
Right.
So thank you,
So
President Trump.
David asked the second question that's much easier, that as to whether there's any charge for the naloxone in the vending machines. And there's never a charge for our state supplied naloxone. People can't charge for it. And there's no charge in either of those for the naloxone in either of those machines. And, we now that there's some competition to different naloxone products, some products even, that are reversal agents without naloxone in them, the costs have gone down, and that's a positive thing. So I'm not too concerned about that. Let me see what else we've got.
Gordon, if you wouldn't mind real quick, I've answered a lot of the minutia questions about the pieces of legislation, but
Sure.
the thing I wanted to just tell everybody is that you can look up each of these pieces of legislation if you're interested in reading the actual document and not just receiving it from us. I'm going to drop the link that you do that in the chat. And so you have access to that. And all you have to do when you go to that link is there's a little box that says paper or LD number, and you put the LD number, which is the number we all keep saying, like LD 1714, in that box, and you hit enter. And then it pulls you up everything that you can read yourself.
Thank you. There's a couple other questions here. One is directed to you, Courtney, and this is from our friend Jennifer Edwards in Auburn, with doing public health work in that city and doing such a great job. She says if Lorena could send out the list of the proposed protected crimes under LD 1911 with the follow-up email for today's webinar, that would be greatly appreciated. We could do that, couldn't we?
Yeah, I think I was trying to speak to that, and you can look it up on the website, but I also think we can just pull together a big PDF of every piece of legislation that we talked to today and send it out to you all so you can read them.
Another question is whether there's a public list of recognized recovery community centers in Maine. Person did a quick Google search and did not find one. I'm embarrassed to say it's not on our website at the Governor's Office of Policy Innovation in the Future, but there is such a list, and it's maintained by the Portland Recovery, by the Recovery Center in Portland, the PRCC, the Portland Recovery Community Center. I think if you go to their website, because they are the hub for the centers in Maine, you and have done a pretty good job of maintaining a list of those. I've seen that list, and so I think we can find it on their website. If not, Madison Barras is here with us on the call, and we can get that list from them. And we should put it. It should be prominent in both the Maine Drug Data Hub and on our own website at GoPIF. We have about 20.
Your support team has already taken care of it in the chat.
Perfect. We have about 21 centers. Of course, occasionally we'll have one close, and fortunately we have some open, and so they change somewhat from time to time. But we've had a pretty stable group, and again, we're really pleased that we've got the sustainable funding now through the cannabis tax, through the efforts of Representative Rana and Courtney and many of you on this call. That money comes in every year, and so we now have unfortunately, we don't have enough money to sustain in a generous way 20 to 21 centers, but we will stretch those funds as far as we can and supplement them with other funds. I always first ask when somebody calls, have you gone to your county settlement funds? Have you gone to if you're in one of the 23 municipalities that have funds? Because those funds are perfect for a recovery community center because they're not millions of dollars. Some towns might be getting $10,000 a year. So what are you going to do really meaningful in that community? Give it to help support your community or in the community recovery center. I believe that those are all the questions that no, just a minute here. I've got one down here. What recovery related legislation are you all thinking about going into the short session? Oh, what a wonderful question to close with. Courtney, I'll have you go first and then Representative Rana, and then I'll close it out.
So MIRAP is focused on bills that have been held over, and we are prioritizing at this time the bill that seeks to automatically seal criminal records, as well as expanding our campaign across the state. That's not a legislative campaign, but a local campaign to ensure the transparency of opiate settlement money all across Maine. So those will be our two big campaigns for 2026, and we look forward to anything that our friends in the legislature propose. We will watch and monitor, support, or oppose, depending on what those pieces of legislations look like.
And I'll just add that my priority is making sure that we can fund and fully implement LD 1738 so that municipalities across the state can have some support in cleaning up syringe waste, which will go hand in hand with increasing access to harm reduction programs.
Plus one to what Representative Rana said. We will also be full force on that piece of legislation as well.
I can say that I've not prepared any legislation be submitted through the governor's office. We of course will be working on the 61 bills that are on the governor's desk, as well as the bills that were carried over. There's a few of those that deal with the issues we've talked about today. We're already in an active election cycle, so there's a lot of things that are out there that are said that are not accurate, and so my general approach in the governor's office on opioids over the next few months. Well, let's be honest. I mean, the governor and I have like 15 months left or something. Is to keep going all the good things that are going, because that is what's leading to our reduction in overdoses. And so, equal parts of prevention, harm reduction, treatment, absolutely, and recovery support, recovery residences, recovery coaches, recovery community centers. So, I mean, I think that our plan is sound. I think that it's working. So my job really is to gather up the resources to make sure that if we were to lose some of our federal grants, for instance, that we're able to keep the core forces that we have out there. We're very proud of our options program. Today, we're very close to having a full 32 people on the ground every day in all of our counties, supported by 7 to 9 recovery coaches. No other state has a program like that. And so naturally we get asked, well, what's going to happen to the options program when Governor Mills' terms expire next year? And that's really wholly dependent upon who the next governor is. So let's leave it at that. I hope that you'll all join us again on October 3rd, where we've got our team from Healthy Acadia coming to talk about the Youth Recovery Coach Pilot and all the good things that's being done for youth and adolescents. And again, I want to thank not only Courtney and Representative Rana for joining me today, but obviously Lorena at ADAPT. We couldn't do any of this without Lorena and Madison Marassa, my colleague within the Office of Behavioral Health. I hope you all have a great weekend. And pleased to say I'm headed to the Outlaws concert and to hang out with Bob Dylan and Willie Nelson. And apparently, when you're our ages, at 70s, 80s, 90s, the concert's at 4 o'clock after nap time, and I'm so thankful for that. So have a great weekend, and thanks for joining us today. Thank you, Representative Rana. Bye-bye.